Hello, good morning, everyone. Once again, we are pleased to have you join this call for this discussion. Our panelists, Dr. Mushomi, Dr. Isaac, Miss Winnie, and myself. You're all welcome. And our August listeners, we are so pleased that you took some time to join us in this conversation. I'm going to do the welcome address and the introduction, then I'll hand over to Ms. Winnie, who will moderate the session. As we all know, climate change is a complex and urgent global challenge with far-reaching implications for human health. As the planet warms due to increasing greenhouse gas emissions, the impacts on global health have become more evident and concerning. We've been witnessing impacts such as temperature rise. This is evidence. We don't need to tell audience what this means for us. We've also had a series of extreme weather events in Malawi. I think the most recent one we've had to do with Cyclone Freddy, a very violent and devastating one, of course. There have been health impacts, spread of infectious diseases, heat-related illness, and effects of extreme weather events are a concern at the moment for public health. Food security is also an issue. We are increasingly witnessing that crop yields are actually on the low, and this consequently affects food prices. And of course, if we are witnessing the rise in food prices, it means we are going to have concerns with our nutritional requirements and what we need to be a healthy community and for a prosperous nation. So the impact of climate change, as I earlier on indicated, is very much obvious. There are studies that have been conducted, and there are a series of reports by the Intercontinental Panel on Climate Change and other renowned research bodies. Most of these reports emphasize the vulnerability of various regions and communities to climate change and discuss adaptation strategies to reduce those vulnerabilities. But studies by ArtGlo and partners, I think in the most recent, the early part of the first quarter of this year, also did reveal some enthralling impacts, such as sexual and reproductive health issues when we conducted a study. And we also, there were revelations of anxiety and gender-based violence amongst others. So addressing the impact of climate change on sexual and reproductive health rise actually requires a comprehensive and integrated approach. It is in this wise that ArtGlo is holding this webinar to enhance understanding about the interplay of climate change and sexual and reproductive health issues, which are very critical for building resilient and sustainable communities in Malawi and in the sub-region. The webinar under the theme highlighting the interconnectedness of climate change and sexual and reproductive health for policy and programming actually recognize most of the above issues that I've spoken about. The objective of this webinar is to raise awareness, promote collaboration, and identify solutions. In the course of the discussions, there will be opportunity in most of the various sessions for the audience to understand the nexus, the interconnectedness of climate change and sexual and reproductive health. We will also be addressing vulnerabilities, and we will also try to understand the policy space. How can we integrate reproductive health in climate change efforts, the fight against climate change? Then we'll also look at youth engagement and advocacy, how we can rally everyone on board to ensure that we are able to rise up and then fight this challenge that is confronting us. Then we'll also look at how the collaboration and action, how we can collaborate and then take action. So in a nutshell, these are some of the objectives, and then this is the outline in the next 1.5 hours that we are going to have our distinguished panel talk about. Distinguished audience, ArtGlo, Sisonec, Global Affairs Canada, USC Malawi, are delighted to have you and for the time you've made to be part of this discourse. We are pleased to introduce Ms. Winnie Bota, who will moderate this session the next 1.5 hours. I wish you all a fruitful discussion. Zikomo Kwambiri, thank you. Over to you, Winnie.
Thank you so much, Aaron. I hope everybody can hear me. Aaron, you can just note if you can hear me clearly.
Yes, please, Ms. Winnie, we can hear you.
Okay, thank you so much. Thank you, everyone, for having me. Good morning or good afternoon from where you are, or it may be even good evening in other areas. But it's a good day here in Malawi, and I hope it's a good day everywhere across the world. And thank you once again, Aaron, for having me. Without taking much of your time, let me just introduce our panelists in the next 1 hour, 30 minutes, as Aaron said. So we have Dr. Isaac Chua. So Dr. Chua is a senior lecturer in climate sciences and currently serves as the head of Earth Sciences Department at the Malawi University of Science and Technology, MUST, here in Malawi. And we have Dr. Johnny Mushomi. He's a research and policy analyst at the African Institute for Development Policy in Malawi. We have Lekodi Magomba, Youth and Community Engagement Lead for ArtGlo Africa, based in Zomba, Malawi. And we have Aaron Mahama, Climate Justice Program Advisor, World Investor Sons of Canada in Malawi. Welcome, dear panelists. And just to get you through how the 1 hour, 30 minutes looks like, the first part has been done already by Aaron. Now, the second part is going to be our panelists unpacking issues with 10 minutes allocated actually to each panelist. I don't know how that's going to be doable because I know people in their field, they will mostly have a field day. They may take more than 10 minutes discussing, talking about these things, but let's just observe time. So we'll have the first session, understanding the climate change and sexual reproductive health rights. We have a second session addressing vulnerabilities, and then we have the third session integrating reproductive health and climate change policies, and then the last session, youth engagement and advocacy. And then there are some follow-up questions that I may have as a moderator in between. Let's see how that best will be done. And later, we have an opportunity for participants to ask questions and receive expert insights. But then the questions should be dropped in the chat box. Aaron will help in sorting out these questions and referring them to me so that we can share with them to our panelists, and then they can give expert insights throughout the questions. And then the last part will be a call for action. This will be, it's been given 5 minutes. I hope that's enough. So that will be a call for action, and then closing remarks from ArtGlo, and maybe some partners having a few comments to speak, just a few moments to speak in closing. So Basically, that's how the 1 hour, 30 minutes of this webinar looks like. So let's get on with the program. Let's start with understanding the climate change, looking at the nexus, exploring the scientific evidence and research findings on how climate change impacts sexual and reproductive rights. You may have a different document because, Aaron, just for your guidance, the names have changed, I guess. I have Speaker Dr. Kallenberg handling this one on my documents, but for this one, I think it's going to be handled by, is it Dr. Chua? Aaron?
No, I'm going to take this session.
You're going to take this session yourself?
Yes, please.
Yes, now please, okay, so please take the floor. How do climate change and sexual and reproductive health intersect? And what are the key connections between these two seemingly distinct issues? Let's start with that bit.
Great. Thank you so much, Ms. Winnie, for this. Indeed, there is a connection. Earlier this year, I think we've had heavy rains, strong winds, and thunderstorms, and these have affected over 24 councils of Malawi, causing floods and severe weather related incidents, resulting in casualties and damages. And unfortunately, extreme weather events are projected to increase in frequency and severity in Malawi in the future, unfortunately, making the country more vulnerable in the sub-region. Malawi, like many other sub-regions, countries in most sub-regions, the intersection between climate change and sexual and reproductive health is a complex and multifaceted issue. I will want to highlight a few connections. I earlier on spoke about mostly when we have these violent events happening, one of them has to do with natural disasters and displacement. So people lose their places of abode. And Malawi is susceptible to natural disasters such as floods and cyclones. The displacements often results from the cyclones, and events creates vulnerability or exposes communities. This exposure presents situations where Malawians' healthcare infrastructure tends to be vulnerable or gets to a state where communities become vulnerable because of healthcare infrastructure destruction as a result of violent events resulting from climate change. And when these things happen, or when there are disruptions in healthcare services, it actually limits access to family planning, maternal health, and then other reproductive health services. One other connection when there are events, violent events happening, has to do with food security and nutrition issue. Most people will tend to lose their farms, and which means there's going to be low or virtually no yield for them, for the households. And when this is lacking, of course, this has this consequent impact on lack of household income to even procure foodstuffs. And we all understand that Malawi is about the population that is into agriculture is about 85%. And you can imagine when these events happen, the kind of vulnerability or the state in which people find themselves. There are also incidences of women. We can talk about women's role and then gender dynamics. Of course, women in Malawi often also play a key role in agriculture and natural resource management. Climate-related stresses impact women's workload and influence family planning decisions, and even the time to access reproductive health services. There are also issues of water scarcity, because most wells will get flooded by, let me say, contaminated water flowing from upstreams, which means there is not going to be clean water for personal hygiene. So there are a series of connected effects of climate change when these events actually maybe just to hold on a bit and then wait for the subsequent questions that may arise. Understanding and addressing these connections, for me, I think is very essential for developing tailored and effective strategies to enhance resilience and protect reproductive health and promote sustainable development in Malawi. And I think collaborative efforts is actually required between agencies and departments. Thank you very much. I'll hold on a bit at this moment and wait for further clarification.
Thank you so much, Aaron. Actually, thank you for the highlights that you kindly shared. Now, just to follow up with you before we proceed with other questions. You know, Malawi as a country, we've been tipped by, you know, the meteorological department several times, environmentalists, different experts when it comes to disasters, that as a country, we are vulnerable. Do you think we've done well in preparedness as a country with the collaborations that we've had? Much that disasters do come as emergencies, but we are aware that we're vulnerable to these emergencies. Looking at how we plan and looking at how vulnerable our health system is already, do you think we are making strides? Do you think we can do better? What can you say about that?
Yeah, thank you very much for this question. I wouldn't say we've not done well in terms of preparedness. Of course, we have health facilities. What actually I would say probably we are not ready has to do with enough budgeting and maybe accountability to ensure that finances that is allocated to address health issues when these events happen. That is the point where probably I would say is not adequately catered for. The other thing has to do with early warning systems. I think this actually it will require improvements. I wouldn't say it's not there. Of course, we have the Meteo providing, how do we call it, weather information all the time to citizens. The other challenge probably might be for the class of people or the community people that are not able to probably read what is shared by the Meteo office. And if it has to do with radio, what is the coverage? That is where probably I will want that more is done. If it's radio and it is done in the local language and at the appropriate time that everybody can hear or listen to, and then make use of those information for their decision-making in their daily activities.
Thank you so much, Aaron. Now, briefly though, in what ways do you think addressing environmental challenges and climate change policies, as well as strategies, can contribute to improving sexual and reproductive health? Bearing in mind that Malawi as a country, we do have a number of good documents when it comes to a number of issues. Now, how do you think addressing environmental challenges and climate change policies can come in to address the issues and challenges to do with reproductive health rights, sexual reproductive health rights.
Yeah, thank you very much for the follow-up question. Some of the things that have been going on in Malawi, I think there have been a couple of studies by the International Food and Policy Research, and they've tried to categorize households or those involved in agriculture to, I think, 4 categories. And we have a group, a very huge, large group that is involved in subsistence agriculture. Of course, I earlier on mentioned that 85% of the population is involved in agriculture. If there must be a solution to this, one key area that has to be looked at is sustainable agriculture. If we are going to count on commercial agriculture, we can begin to look at, how do you call it, situation where we have matchmaking, where citizens or those involved in commercial agriculture can actually make their own savings and then tap into other resources that are available. But for the majority of the people that do not have money to save, we should begin to look at social protection measures to actually be able to support them. So social protection, I think, initiative will be very key in Malawi. One other thing I feel can be addressed, and I think maybe some of my colleagues may touch on, it has to do with policy, comprehensive policy integration, ensuring that environmental policies consider reproductive health and vice versa is very crucial. Why do I say so? This interconnection actually requires that we foster holistic development that considers both environmental sustainability and reproductive health. So policies should put in strategies that responds to not only, for instance, agriculture, for instance, cultivation activities, but there should be measures to actually address sexual and reproductive health issues. I'm sure if these issues are discussed earlier on, the possibility that unfortunately when the events happen, people already have the knowledge and not to involve in or how do we call it, to be able to cope when the events happen. I will leave I don't want to respond to all. I think these 2 submissions are enough for now, and then we'll pick from the other panelists, if you permit me.
Yes, actually, I still have one last question for you on research gaps. I would really want you to, in 1 minute, key research gaps in understanding the impacts of climate change on sexual and reproductive health. What are these gaps, and what should the scientific community and funding bodies prioritize? Just in a nutshell, in a few statements, Aaron.
Okay, great. For me, I think the first point, I'm just going to go straight forward. One of the key things that's the gap that exists is limited longitudinal studies. Like over time, how much data have we gathered to study the trend of climate change impact on sexual and reproductive health? That gap, enough data to be able to do some kind of panel study on how things are going in our communities is lacking. And we actually need to invest. We need the donor community to support research so that we have enough data. And if we have enough data, we can make decisions, scientific decisions based on the data that is available to us. So that is one gap that I feel exists. Yeah.
Thank you so much, Aaron. We'll still come back to you later on in the program. Now, moving on to Dr. John Mushomi, just to look at addressing vulnerabilities and to analyze the disproportionate effects of climate change on marginalized communities and the importance of promoting gender equality in climate resilience efforts. Dr. Mushoni, good afternoon or good morning. The first question from me to you, how does climate change impact maternal health? And what are the potential implications for pregnancy, childbirth, and postpartum care in areas affected by extreme weather events? We've experienced this in Malawi quite a number of times in the past 5 years. Dr. Mushoni, hope you can clearly hear me. Over to you.
Thank you, Winnie. It's a good morning here in the city center at in Lilongwe, and good afternoon for those of you where it is afternoon. So my name is John Mushomi, and Ellen already mentioned, and Winnie, I contribute to a project at the African Institute for Development Policy that seeks to realize or to foster increased political commitment and financing for increased voluntary family planning. And we do this by encouraging or fostering cross-sectoral interlinkages between population dynamics, health, environment, and development. And we argue in our work that some of these challenges that we face or that populations face require cross-sector interconnectedness solutions, because problems are also interconnected in their own nature. And diving straight, Winnie, to your question, I thought I would also contribute a few of what we know, evidence that is out there, that typically a quarter of the people that are affected by any crisis, be it environment or climate change, extreme weather changes, usually a quarter of these, you will typically find that they are women of reproductive age. And that speaks quite a lot in terms of inequalities and disproportionate effects when it comes to disaster. And at any time, Winnie, you'll note that 4%, evidence has it that 4% from the Family Planning 2030 projections and analysis, we've been shown that 4% of any displaced or disaster-affected population will be pregnant at any point. And 15% of these women will certainly face pregnancy-related complications. And I think Ellen already alluded to some of these. When crisis comes up, or when populations are affected by different sorts of crises, we all know that different people cope differently and they are affected differently. So it is also important to note that 60% of the preventable deaths that arise from women giving birth to life, 45% of these newborns take place in fragile contexts, contexts that are actually affected by climate change, crisis, contexts that are affected by extreme heat from climate change related events. So of the 60% of the maternal deaths of the women that die that are giving birth, 45% of these are happening as a result or in the context of helpless, fragile situations. And probably this partly helps us to point to the need to one of the questions you've actually asked. I would like to do a follow-up of a need to understand the detailed broken down understanding of who is affected, how they are affected, what is their magnitude, and who are they and where are they. And in this case scenario, reproductive health issues are usually ignored because the quick, fast line needs that are presented are food, shelter, water, and all that. But we forget that life continues, and this is a whole person. And the whole person includes women, children, youth, the elderly, and all that. And happy to know that ArtGlo and partners are contributing towards the efforts of raising awareness and understanding that there are critical reproductive health needs out there that are rarely attended to when it comes to responding to crisis. And I think for me, it is very important to take note, like you have actually mentioned, that when this happens, population dynamics like reproductive health services need to be understood in the context in which they impact climate change. And therefore, there is need for individual management of timing of pregnancy, understanding the needs of women and children and girls and youth who are affected, and being able to improve their resilience and adaptive capacity, both in the short term and the long term, to decrease immediate vulnerability. And therefore, the need for understanding the provision of voluntary family planning for women and young people to be able to choose the timing and spacing of pregnancies and their family size remains central and critical. Climate change, when it comes and its effects, needs will not wait. They will remain constant, and sometimes they're exacerbated by the realities of climate change. And sometimes it's important to also take these into context. So when this happens, from me, really in a nutshell, to say that we experience and we've noted an increase in preterm births as a result of climate change and crisis-related conditions. We also experience that climate change would naturally lead to incidences of related diseases, ranging from infectious diseases that have a significant impact on maternal and newborn health, and therefore access to maternal and newborn health care can literally be disrupted. Aaron earlier mentioned at how much the infrastructure, the health infrastructure, can be disrupted by climate crisis. Similarly, if infrastructure is disrupted, also services are disrupted in a way. And some of those where we've seen it even during COVID time, that many countries dropped the ball of reproductive health service provision during COVID-19 in a wake to provide services like food, shelter, and social protection and all that. Reproductive health services were not included in the social protection services package as well. And health services, particularly on the borderlands, were severely affected, and access was complicated in a way. And therefore, to crown it all, this begins from delays in accessing these services, and this has had serious consequences for women who are pregnant, newborns that are born, and access to these services have been really disrupted. Just to note that for Malawi, if I can dive into Malawi, and as I conclude this part of response, that the family planning 2030 strategy, Malawi is one of the countries that has made the commitments. And I would like to allude to you, to yours and your sentiment about the governments in Africa, not only Malawi really, having good documents, but I think it's also good to give credit where it deserves. And I think Malawi, compared to many other countries, has at least taken a step to have documents. And I think for me, that's a good state. Right now, Malawi is one of those countries that was evaluated by UNFPA that has actually included reproductive health in their emergency response and preparedness. And that needs to be appreciated, so that we begin from there as a government and as decision makers, but also as practitioners. But also it is good to note that as a government, Malawi has also included emergency response and preparedness emergency and preparedness response as part and parcel of their commitments, looking at a document on family planning and the government including reproductive health services. It is very important, and I think for me, this document begins to give us an initial thinking about the interconnectedness between family planning, reproductive health, and general health aspects in terms of climate crisis response as a government. And I think they deserve to be appreciated. The technocrats, the government, and the decision maker that spearheaded this process.
Oh, thank you so much. Actually, you've quite covered so much, even the follow-up questions that I really wanted to ask. But still more, I have to ask, too rich data in what you just presented to us here, Dr. Mushomi. Just to appreciate, have you, I know you have shared with government and other, decision-making bodies that we have in the country, or maybe in other countries as well. Has there been an interest to go practical now with what we have in the papers and all that, from the suggestions that you've made? Have you been in spaces where these suggestions were taken seriously, and then you at some point you could see that we are going practical as a country, moving from document office-based decisions to now going practical on the ground? Just a few words from you on that.
Thank you, Winnie. Malawi government and partners may not necessarily be running the talk, but they are beginning to walk the talk in a way. And thank you for asking me to speak to a few of the options I've seen. As a project here at the African Institute for Development Policy, we were excited to participate in Malawi's launch for its national population policy. And one of the themes, you'd be happy to note that one of the themes for the policy is that it recognizes the importance of interconnectedness, intersectoral interconnectedness. And I think for me, you will be realizing that departments of climate change, forestry will be participating in issues to do with population. For a long time, many countries, some of these population policies are either a remit of ministries of health, a remit of particular departments and all that. But I think for me, within this policy, once implemented and once money is committed to the policy implementation, already the strategic document has included different sectors in a way. I also like to note that Malawi government hosted the regional climate health and climate change policy, which was a precursor to the conference of parties that is happening in a few months, probably weeks from now, not even months. And these conversations, there came a commitment, and which included a high recognition of health, attention to health issues in climate change and in climate change action. And the Minister of Health herself was able to lead the podium and lead the people that went to the Africa Climate Summit in Nairobi, in Kenya. And I think for me, this was speaking quite enough, enough on what government commitments are and what capacity government can do if they contribute. Finally, our project, like I mentioned, we foster the importance, we foster cross cross-sector interlinkages in advancing increased commitment, political commitment and local financing for voluntary family planning through a cross-sector approach. And already tomorrow, we are inviting over 16 sectors that are coming together to speak, to spend a day together, to reflect on what their roles could be, to guide this strategy for the government, for the country. And I think for me, these will be good steps towards committing money. What is remaining, Winnie, is to analyze budgets of different departments, of different sectors, to be sure that health is putting climate change action budget that climate change departments and health and sectors are including health and productive health budgets, water, forestry is including family planning and reproductive health budgets, and family planning and reproductive health is also including health, biodiversity and forestry budgets in their plans and budgets and at both national and local level. And you may note that the next step to move as a government probably is to move from national to subnational level and include and leave no one behind. Finally, again, we participated in putting together the traditional gatekeepers of the country. We gathered over 50 chiefs in Malawi, and they appreciated their need as gatekeepers to advance the need to work with different sectors at subnational level to guard resources that are under threat through a cross-sector perspective, and this was very much appreciated. And we look forward to government's commitment to supporting these processes and initiatives in the country.
Well, thank you so much, Dr. Mushomi. I'll still come back to you later if time allows. But for now, let us move on to Speaker Dr. Isaac Chua, just to look at integrating reproductive health in climate change policies, showcase successful case studies and policy interventions that incorporate sexual and reproductive health into climate strategies. Good morning, Dr. Chua. Just to ask you, what are the unique challenges faced by the populations, and how can we ensure their needs are included in both climate change and reproductive health policies? Dr. Chua, hope you can hear me, and it's over to you.
Yes, Winnie, I can hear you. Good morning and good afternoon, everyone. The speakers before me have touched on most of the areas that maybe I might have spoken to. So in so many ways, that actually makes my task a little bit easier. So thank you to John and Aaron for that. Your analysis is spot on. So there's a serious intersection between sexual reproductive health and rights and the issues of climate change. But coming to your question, I think there are maybe 3 levels that we can look at in terms of how you can integrate these issues. But before I get to that, you ask about the challenges. I think John has highlighted most of those challenges. But maybe just to give it a little bit of a local context, if you go to most of the communities that have been hit by the recent cyclone, I've been to a number of them. I've been to Machinga, Zomba, I've been to Chikwawa, to Sanje. When you talk to them, almost always issues that border on sexual and reproductive health, they'll come up. So apart from the immediate needs to do with access to food, water, sanitation and others, the sexual and reproductive health issues will come up. For example, in one of the communities in Palombe, because of the social dislocation and displacement resulting from the cyclone, there was some kind of a cross-border sort of migration of some of the community members to Mozambique. And you hear stories around sex trafficking, for example, some of the young girls being trafficked. You also hear stories, around, early marriages, parents marrying off their young girls quite early so that, they can use that as a tool to put food on the table. But also, you are going to surface out issues around, STIs. So, in terms of, especially in camps, where I think John mentioned that they don't have, easy access to these services, for example, contraception and others. So you're going to uncover stories around, the infestation of STIs, pregnancies and all that. So all those are the immediate issues that, you're going to hear. But also I want to draw our attention to some of perhaps the more distant effects that will come. Okay, because I mean, when things such as climate-related disasters happen, you're going to have immediate impacts or effects of that, but some of them are more long-term, and sometimes they are slow onset impacts. For example, currently, you're going to see that in most of the areas where infrastructure was damaged, so be it health-related infrastructure or roads, in most of those areas, we have not rehabilitated, or maybe we have not fully recovered, and we still have people living in camps. So the key question is, to what extent does that even worsen the situation that I've described? Probably, maybe if we were to go and try to do a little bit of an analysis there, you're going to see that these effects will multiply, multiple folds. So the impact of climate-related disasters on sexual and reproductive health, I mean, it's not in question. That linkage is not in question. But on the other hand, when we, I want to extend the analysis further, because maybe we've looked more, in terms of the response issues, but maybe let's try to go a little bit, backwards to look at how maybe we do our programming, be it, mitigation interventions or adaptation interventions. These can, whether directly or indirectly, contribute positively or negatively to sexual and reproductive health related issues. They can do that maybe intentionally or unintentionally. Okay, so that's why it's really important that at so many levels, whether at an institutional level, whether at a programming level or at a project level, you pay attention to these issues, because your programming could be exacerbating the situation, could have, maybe your program or your project could have unintended consequences that will worsen the sexual and reproductive health-related impacts of climate change, or it can contribute a little bit positively. But also, we need to go beyond maybe just looking at mitigation adaptation, because there are certain irreparable or irreversible damages to societies, to the environment, to infrastructure. Okay, so right now, I think within the climate change debate, there's a notion of loss and damage that is emerging. So I think we should latch on that debate and start infusing into that debate issues of sexual and reproductive health. Of course, we are saying, around mitigation adaptation, we're not doing enough. We are doing something, we're not doing enough. But there's this emerging discourse around loss and damage. To what extent are we informing those discussions? Very soon, there's going to be a conference of parties is it in Abu Dhabi, I think, from my recollections. It's just next year. To what extent are we taking this discussion to those important international forums? So whatever commitments have been done at that level, also they are looking at these issues. So the mainstreaming around policy, it can be done at international level, but even more so, maybe regionally, we should look at the regional instruments. Okay, how much are we talking about these issues? John, I think, has mentioned, cases. Has given us the data, very important data to inform these discussions. But how much are we mainstreaming? Let alone nationally, it's important that we're making strides. But what I see for Malawi, it's not just around issues of sexual and reproductive health rights, but there are so many other issues, is that I think we are still a little bit disjointed in terms of how we do things. I was just thinking, if I were to go to the Minister of Health, for example, and listen into the policy discussions happening within the ministry, to what extent will the issues of climate change pop up, and even let alone intersecting that with issues of sexual and reproductive health. So I think we really need to take this discussion at a planning level. Policies have a life cycle. So there comes a time when the policies are reviewed. So perhaps experts such as John, with the evidence, the good evidence that he has uncovered about Malawi, we need to participate in those discussions so that there could be policy commitments, there could be sort of policy goals that are looking at these specific issues. So usually this is ramped as a cross-cutting issue. People talk about gender, but without even unpacking that. Because when you look at issues of gender, sometimes the default positions are you only consider women, but sexual and reproductive health is what we call, it has got intersectionality to it. So you look at intersectional identities, issues of disability, issues of age, poverty and inequality, all that will come into play. But what you find is that we only look at maybe women, and most of the times we just gloss over that. So we really need to have a serious discussion in terms of to what extent are we mainstreaming these issues into national policies. We need to, in other words, if we're not invited to the table, we need to invite ourselves to the table where policy discussions are happening, especially maybe in other ministries, such as Ministry of Health, Ministry of Gender, but also the Ministry of Natural Resources and Environment. To what extent are people discussing about issues of sexual and reproductive health? So we really need to, first of all, infuse this discussion at that high level. And then we really need to also do the same, the same thing, maybe local structures. If you go to the local villages, when you're doing planning at the village level, to what extent are these issues taken seriously? Or maybe when you're training VCPCs or the other local structures, to what extent are these issues coming up? So we can do it at so many levels, just to answer your question short. Thank you so much.
Thank you so much, Dr. Chua. But briefly now, because I know even when I say briefly, the speakers will still go full throttle on it. But now briefly, what are some specific successful examples that you have of other countries or other regions that have effectively incorporated these issues, sexual reproductive health policies, climate change adaptation and mitigation strategies in their policy frameworks? Do we have specific examples that we may look to and maybe draw some lessons from there?
Yeah. I'll just mention maybe a couple. In Kenya, if you look at the Kenya's nationally determined contributions, one of the key considerations when they're developing that was to do a very detailed gender analysis. That's one example. But also, you can look at Tanzania. Tanzania has tried to link, issues around sexual and reproductive health and rights with resilience. So the evidence there is also showing, I think there was a study that was done in Tanzania. It has shown that indeed, if you look at these issues seriously, they do make a significant impact on building resilience of communities. But also there are many examples in Southeast Asia. You can go to Myanmar, Vietnam. There are so many instances that we can draw from. Thank you.
Thank you so much, Dr. Isaac. We have a number of questions, actually. There are a number of questions in the chat box, but I'll come back to them later. They're specifically addressed to you, Dr. Chua, and Dr. Mushomi. So I hope you'll still be on standby. I'll come back to you just in a moment. Let's move on to Mr. Lekodi Magombo. Youth engagement and advocacy. Just to highlight the role of young people in climate change and health advocacy, focusing much on reproductive health rights. Mr. Magombo, a question for you. How can young people be empowered to advocate for both climate action and comprehensive sexual and reproductive health education and services? Just to mention that recently we've seen youth involvement in quite a number of spaces when it comes to advocacy. Now, just to answer the questions, how can young people be empowered for you maybe to advocate better and maybe go deeper than what we're seeing at the moment on the ground? Mr. Magombo.
Yeah, as a start, I think the key factor there is the ability to actually advocate itself. Young people need the platform and the space in order to be able to do their advocacy. A lot of these young people, they lack sort of ability and the opportunity to do sort of the advocacy work. So as a start, we have structures such as CBOs, CSOs, youth groups, youth organizations that are very key within our communities, and supporting them through these mechanisms will be one of the key factors in which they can advocate directly on the ground. On top of this, a lot of young people, especially now, are exposed to technology. So the ability for them to also and share
use of digital platforms that we currently have available is also a big factor. And them also being able to directly engage with one another and be able to share their concerns openly, one of the factors that really allow them to engage with the issues that we're talking about.
Now, there's been an argument that there may be some knowledge gaps when it comes to youth advocates. Do you think we need education initiatives that can bridge the gap between the areas of reproductive health and climate change issues, so that we may have meaningful engagement when it comes to young advocates taking part, or maybe taking a leading role when it comes to issues of climate change and health advocacy? Do you think we need education initiatives?
Yeah, no, certainly. I think as a start, the in-school comprehensive sexuality education is very important for us both to have a reasonable structure that is specific, but then also age appropriate, considering that with our school structure and sort of like the differences in ages that we find at different levels. But it starts with the in-school sort of education that we have already. Then out of school, we have, for instance, the youth-friendly health services, which are very key in a lot of rural areas in engaging young people around sexual reproductive health and learning. And then there's also the CBOs and CSOs that I mentioned earlier that are directly engaging the youth. They are teaching the youth, and there are standards of practice that they can follow that are available freely even to be able to young people. And then I think at the same time, it's important for us also to examine our communities of practice. I think, as mentioned earlier, government plays a big part in terms of how, at the end of the day, young people themselves receive the information, and the government being at the forefront of also making sure that the knowledge is adequate and also the right information is also one of the key factors that help the education of young people in this particular area.
Now, just to add, Lekodi, we may have seen it that young people are getting involved in health advocacy. But now, as an activist, as a young activist, do you think you as young people are given much roles as you expect to take part in reproductive health as advocates, and maybe collaborate with environmental organizations to effectively drive positive change at the intersection of these issues, climate change and sexual reproductive health rights? Do you think we as a country, maybe we've done enough to involve you as young advocates?
I think there's more that could be done. I think there's a lot that's currently going on. We need to acknowledge the fact that even, for instance, how our policies are currently being developed are a lot better than, let's say, 50 or 30 to 40 years ago when policies were just top down. At least now with decentralization, there's been a sense of bottom up sort of some policy influence, but there's still more that needs to be done in terms of how that now translates into actual practical work on the ground. At the same time, I think it's important to also recognize the fact that young people themselves also need more in terms of the education side of it, understanding and knowledge of the issues in order for them to adequately participate, but they also have their own practical day-to-day things that they face on the issues that they can share. So a balance is needed when it comes to youth participating. In terms of the intersection of the two, I think it is something that we can do better, especially here in Malawi, in terms of environment and reproductive health. It's something that hasn't really been majorly addressed, and not as mainstream as it could be. And it's something that we could do better at, mostly in collaboration between both youth-led organizations and environmental sort of organization. And we can look to sort of regional coalitions that already exist that are trying to get this sort of started and bring Malawi to the table with our youth also at the forefront.
Thank you so much, Lekodi. I will still also come back to you later if time allows. But for now, let's check what's in the chat box. I'll just read it out. I think Dr. Mushomi and Dr. Chua, one of you should check these. The first question is there any budgeting support and what is the estimated allocation? Is there any budgeting support? And what is the estimated allocation when it comes to sexual and reproductive health rights and climate change issues? Do we have a specific budget support? And what are the estimated allocations? Dr. Mushomi and Dr. Chua, one of you please take it up.
I think that question was addressed to John, if I checked correctly. So John can take it up. Yeah.
All right.
Thank you very much. I would like to appreciate this question, and it speaks to what Winnie, you asked Elon about what could be the research gaps we need to fill. And I would like to retaliate that I think beyond mention, I think we need to get moving. I think Isaac has already mentioned something to do with the Dubai meeting for the COP. I know that as a project here, we've contributed towards text in the Malawi position, and happy to note that Malawi will be straight and clear on the need to include gender, reproductive health in climate in their communique on the climate conference. Probably next stage would be to getting governments commit to appropriating budget. As I speak right now, this is not anywhere in my documents that I know. We did this study once and in Uganda, and one of the studies you might want to reach out to, and I'm happy Isaac mentioned the 3 countries. We just started a study on analyzing 4 documents, climate action documents, and we do hope that we shall have some communication, the extent to which budgets are also covered. We are analyzing the extent to which family planning and productive health are included in the NDC documents, the NAP, the NAP, the HNAP and NAP and the GAP in Uganda, Kenya, Tanzania, and Rwanda. And probably other countries might pick a leaf on the extent to which these are included in these documents, in the plans, in the implementation projects, but also in budgets. This remains a research lacuna to fill for us as advocates. That advocating is not just speaking in conferences, but advocates is diving into budgets of departments and asking them, how much have you blocked for girls, for women in your budget, away from the Ministry of Health budget? That there would be need to deploy analysts to take to put to task people who allocate budgets and budgetings to ask how much and what percentage and what that means. This remains a gap to fill, Winnie. And thank you for this question. It is very important. Budgeting is the greatest tool for advocacy.
Thank you so much. While you're still there, Dr. Mushomi, there's another question here. These are just forwarded to me by Aaron, by the way. So I may not mention the name of the person who dropped them in a chat box. So while you may have access to the chat box, maybe you may know who are asking these questions. So what regional partnerships or coalitions are leading this cause that Malawi can wish to join, the cause of climate change versus sexual reproductive health rights? What partnerships, regional partnerships and coalitions can you share that are leading in this?
Thank you very much. We'd like to invite our colleagues to interest themselves in a regional partnership or regional institution called the Partners in Population and Development Africa Regional Office. This has done commendable work in terms of bringing decision makers, parliamentarians on the table, and as Isaac mentions, for them, they go beyond being on the table, but also being in the kitchen and part of the cooking. And this really calls for getting the youth on board, young people on board, and those are affected by certain issues, not just be on the table, and you are not sure where the money has come from, because involving in budget advocacy is being in the kitchen, not just on the table. And the partners in population and development has been at the forefront of this, brings together decision makers, parliamentarians, academicians, trying to contribute towards bridging the gap between research and policy. And the second partnership that Malawi is supposed actually to host the next meeting, if I'm not mistaken, is Malawi has been instrumental and has recently been invited as a government to join the coalition, a coalition of the national population councils in Africa. And happy to note that under the population unit, and to our not disappointment per se, but to our hope, is that the Ministry of Finance will soon complete the process of elevating the unit, the population unit, to a desirable department that can have both resources and mandates to advocate for population dynamics, reproductive health across departments beyond the Ministry of Finance. And I think for me, while we have taken the first stage and through the unit in its sense with limited capacity, there has been now an inclusion of Malawi into the coalition of the national population councils in Africa. And Malawi is supposed actually to host one of the meetings. And I think this for me would be a good stage. The last that I know, climate change, I know there is our partners in PAJA, which advocates for climate action, and we are taking steps in cooperation with AMREF Africa, Health, and other partners to advance climate change, to advance reproductive health language in climate change communiques across the board. And our project again, which is funded by USAID, thanks to the American people, that we are advocating for a concerted effort for all sectors and actors to advance this in all sectors, not just beyond climate change sectors. Thank you.
Thank you so much, Dr. Mushomi. And this one, maybe Dr. Chua, you may take it up with, or even Dr. Mushomi and Lekodi, you may also come in, as you may wish. With the recent introduction of new policies relaunched and in development, National Youth Policy, Safeguarding Policy, Reproductive Health Policy, National Climate Change Management Policy, are these adequately addressing these issues? We're talking of issues to do with climate change and sexual reproductive health rights. Do you think the newly introduced policies and those that we've relaunched as a country and those that are in development are adequately addressing the issues discussed at hand? Maybe Dr. Chua, you may come in, and as Dr. Mushomi is taking his water, maybe Dr. Chua, you may come in, and Lekodi, you may also wish to jump in at some point.
Thank you for that wonderful question. It's an important question. So that is quite a tapestry of many policies. Some of them I've looked at, some of them maybe not. John and other colleagues would come in. But as far as the other policies, for example, the National Climate Change Policy, I've looked at it at length because, I mean, that's my area of interest. So what you're going to see there is that, of course, there is gender mainstreaming, but I think specifically the specific focus is on women. But as we've indicated, you know, issues of sexual and reproductive health are very intersectional. So you have a number of elements there. So perhaps, you know, the other elements are sort of, they do take a back burner in some ways. But I guess there is some kind of an awakening. There are discussions going on. I think we do realize that I think these issues, you know, are not really centered when we are talking about policy issues. So in terms of the discourse, there's a discourse that is emerging, especially coming from the experience that we've just had. For example, if you're doing post-disaster needs assessment, we realize that you don't disaggregate data enough. So you find that most of the data is not really disaggregated to that nuanced detail, where you're looking at all these vulnerable groups in terms of how they're impacted and whatnot. So perhaps I think, if that gains traction and then it has to carry on into most of the policy discussions, then I think that will help. But of course, again, you find that I think, most of the sectors are also taking climate change now seriously. So you're still going to find a text on climate change in most of those policies, because we know that climate change is not just a single sector issue. It cuts across many sectors. So yeah, there is some progress that we need to acknowledge, but I think we can do more. Thank you.
Maybe I can just come in a little bit. I think agreeing as well is that our policies touch on climate change at different levels. The recently launched youth policy, for example, also touches on it, and considering sexual reproductive health is such a cross-cutting issue as well. It's one of those topics that at least is somewhat talked about and touched on. I think more will be needed in terms of how now that comes out as actionable ground in terms of programming and policy implementation through various sectors and also partners and actors country. So in the long term, the policies are a good basis, but they shouldn't be the only reason for us either being active or inactive in the space.
Dr. Mushomi, do you have anything to add?
Yes, I'd like to come in particularly on the Malawi population policy, Winnie, and like I mentioned in my update, that the policy has gone ahead and done an implementation plan, and as an action, it includes setting up a technical working group, and the technical working group beyond the policy, including a theme on disaster preparedness and climate change. It also includes a multi-sector technical working group. And this includes people from different sectors, and certainly climate change, biodiversity, forestry, all these are included. And I think for me, the question we should be speaking here, and I do hope that we will include it in the call of action, the call to action, is that we could go beyond speaking English and having good documents, but also include budgets. And also when we include budgets, we also do follow-up actions on whether money was spent on where it was supposed to be spent. I think for me, those are the critical parts beyond the documents, as you mentioned, Winnie, in your opening statement. I mean, we can enumerate as many as possible. Malawi is one of the few countries here that set up a family planning 2030 commitments, and one of those few countries that included emergency preparedness and response. And this is a landside document that is driving the nation to the next couple of years. And the government has included this in family planning, climate change in family planning and productive health. But the question is, we should follow through and know which departments have a budget on climate change, which health-related departments have a budget on climate change, and which climate change departments have a budget on family planning, and where does this money go? Does it go on dinners and workshops and transport refund and fuel and workshops? Does it go to the women who are in the labor? Does it go to the infrastructure, services, medicines and supplies and all that? That whole nuanced analysis that Isaac talks about is extremely important. These documents have generic statements, or we are committed to reproductive health in climate change, or women are very important and all that. But beyond that, we do not see in a program of action, we do not see in budgets, we do not see in auditing. The auditors also need to be probably trained on following up actual expenditures on the key aspects that change the population, or that are game changers beyond documents and talking. Seeing a budget figure is also not enough. Thank you.
Thank you so much, Dr. Mushomi. Actually, all your comments as panelists on the last question, I think we can take them as your closing comments on the topic. You've spoken very well, actually, in making a summary, pretty much. So we can as well take that as your closing remarks as panelists. So thank you so much, our dear panelists, Dr. Isaac Chua, Dr. Johnny Mushomi, Lekod Magomba, a young activist. Thank you so much for your time in taking part in this important topic that really needs to be given special attention, as all the panelists alluded to. Just to highlight what, in summary, what our panelists commonly said. You know, we need to have policies that are a bit integrated. We need to improve on early warning signs. We need to invest in research so that we have data and gaps addressed accordingly. We need to know the data, the burden on the ground. And we need to involve young people to drive, you know, the campaigns to do with sexual reproductive health rights. You need to prioritize when it comes to interventions. Much as that we know that people in emergencies may need shelter and other necessities, they also need sexual reproductive health rights for them to be whole, as you put it, maternal issues. The data is a bit worrisome there. We need to do a lot as a country to address those issues. A country that is already vulnerable to emergencies and a health system that is a bit vulnerable as well. We need to pay attention to this data and address issues. So those for me are take-home issues. And then to quote Dr. Mushomi, he said we need to go beyond speaking English. And again, we need to look beyond mitigation, adaptation, and take discussions further. So from me, I think that's it. I'll hand over to Aaron Mahama. Thank you for having me as your moderator. I hope I did well, and see you again soon. Goodbye.
Thank you so much, Winnie, for this. In fact, hello, can you hear me? Okay. Hello, can you hear me? Hello, Dr. Isaac, can you hear me? Oh, okay, great.
Yes, yes.
Yeah, so we are very pleased with your moderation, and you've really assisted ArtGlo to get the insights from our brilliant academicians and community practitioners. So much insights that we feel is going to assist ArtGlo in its community work in terms of advocacy, mobilizing for advocacy and collaboration. Is really, really going to assist ArtGlo, as we, like Dr. Mushomi made mention. I wish to also quote him. We just don't want to speak English. We want to make sure that these insights provides us the understanding we need to make a case and to take actions in the communities. So ArtGlo and partners, we are really pleased to bring audience this discussion. We will continue to provide evidence-based answers to you for understanding, advocacy, collaboration, and action to our dear audience and all those who made time to participate in this. Going forward, we will continue to share this interaction on the social media so that other people who could not join us today will also benefit from the knowledge that has been shared in this discourse. Then we will also open the gates for people to ask questions. So we are not leaving you, Dr. Mushomi, we are not leaving you, Dr. Chua. For now, when critical question comes, the knowledge that you have will definitely knock on your gates for answers to help people to be able to make informed decisions. On behalf of the country director of the executive director of Art and Global Health Center, Mr. Roger Piri, I wish to thank all participants and especially Ms. Winnie Bota, Dr. John Mushomi, and Dr. Isaac Chua, and Mr. Bekodi Magumba. Thank you very much for joining this discourse. See you again.
Thank you. Goodbye.
Thank you. Bye.
Thank you. Bye-bye.